And time now for another COVID-19 information segment with our Fox 10 News investigative reporter, Brendan Kirby. And Brendan, there's been some uncertainty over just how deadly the coronavirus actually is. Of course, one way to look at this is using the death rate. That's pretty obvious. But the Centers for Disease Control and Prevention are looking at more than just those numbers. Tell us about that.
Well, that's correct, Byron. The death rate is tricky because we don't know for sure just how many people have contracted the disease. And there are also incidents when COVID-19 deaths might be overcounted or undercounted. One measure the CDC uses is to look at all deaths from all causes and then look week by week to see if that number is higher than expected based on recent years. This has some advantages. You can see perhaps if the overall death rate is declining because of deaths from other causes. On the other hand, you can spot when people are dying indirectly, for instance, because of overwhelmed hospitals. Overall, total deaths from all causes since the beginning of February is right in line with the expected number. That suggests that while lots of people have died from the coronavirus, fewer people are dying from other things. You can see in April, when COVID-19 deaths spiked in this country, many more people were dying overall than would have been expected. It peaked the week ending April 11th when there were 33% more deaths than expected based on the average of for that week for the previous 3 years. The following week in April, deaths were 32% higher than expected. So when COVID-19 was at its peak, the death rate was quite high. It was adding significantly to our overall death totals. It's still a deadly disease, but in recent weeks, coronavirus deaths have not been significantly adding to the overall totals.
All right, so everybody wants to know, what about Alabama? Break that down for us, please.
Well, we have a relatively small number of coronavirus deaths here. It was 581 at last count. So as you might imagine, so far, this hasn't been a significant driver of mortality in Alabama. In fact, since the start of February, fewer people have died than expected based on the average for the last 3 years. Deaths have been about 9% or about 9% less than normal. Compare that to places that have been extremely hard hit. More than 40,000 people have died from all causes in New York City, and that's more than double the expected deaths. New Jersey, Massachusetts, the rest of New York State, and Maryland all have significantly more deaths than would be expected in a normal year. So far, the coronavirus has accounted for only 3% of all deaths in Alabama. In New York City, about 43% of all deaths have come from the disease. But not all states that have been hit hard have a higher than usual number of death toll. Coronavirus makes up about 18% of deaths since February 1 in Connecticut, but that number is less than half of the expected total for all deaths. So one caveat about these numbers when you're looking at them, they're based on reports from the states, and they don't always all report the data at the same time. So these numbers can shift over time, but it does give a different snapshot of what we're looking at.
Yeah. All right, Brendan, thanks very much. Brendan Kirby will be back with us on Fox 10 News at 9 to answer more of your questions about the virus itself. And if you have a question, email it to Brendan directly at brendan.kirby@fox10tv.com. He's going to try and answer as many questions as he can get to.